Hey everyone, it's me, number 4, an ancient Egyptian with a hole in his head. In 2016, an international team of researchers used high-tech imaging to scan 41 mummies from the British Museum and the Egyptian Museum in Turin. The mummies were between 2,000 and 3,000 years old and mostly male. And shockingly, one of them had an 8-centimeter hole drilled into his skull. This was no ordinary man. He was a priest named Kamal, who lived around 2,500 years ago during the 26th dynasty. Researchers believe he had an intense pain in his right eye socket that wouldn't go away. So he visited a doctor who decided to perform brain surgery. What's truly remarkable is that this surgery took place 1,000 years before the practice was common in Europe. The operation would have been considered extremely risky at the time and likely only performed as a last resort. But somehow the ancient Egyptians knew exactly where to cut and what to remove in order to save the life of their patient. To make matters even more unbelievable, Kamal survived the procedure and lived for another 10 years after the surgery. In fact, scientists believe that he actually died peacefully in his sleep. Talk about a miracle. Number 3, ancient Egyptian birth control. The ancient Egyptians kept detailed records of nearly every aspect of their lives, including their health. And thanks to these records, we now know that they were using a form of birth control as early as 2000 BCE. You might be surprised to learn that it wasn't just men who wanted to prevent pregnancy. Women also played an active role in family planning. There were several methods they used, but the most popular was a type of diaphragm made out of linen. It sounds pretty simple, yet it was incredibly effective. Other methods included herbal concoctions and toxic plants inserted into the vagina. But these were much more dangerous and could often result in infection or even death. However, the Egyptians were willing to take the risk because they believed that children were a nuisance, and getting pregnant was a disturbance to a woman's everyday life. Family planning allowed women to continue working and contribute to society without the burden of raising a child. It seems that the ancient Egyptians were much more progressive than we give them credit for. Number 2, ancient Egyptian penicillin. The ancient Egyptians had a remarkable understanding of medicine and were known to use herbs and plants for their healing properties. One of their most prized possessions was a fungus that they believed could cure various ailments, including respiratory infections, wounds, and even cancer. They called it the fruit of the Pharaohs, and it's now known to contain a powerful natural antibiotic called penicillin. Penicillin is still used today to treat bacterial infections and has saved countless lives. But it wasn't until the 1940s that scientists discovered how to synthesize it in a lab. For centuries, the Egyptians had been using a natural form of penicillin without even knowing it. They either grew the fungus on bread or ground it into a fine powder and mixed it with other ingredients to make pills. Either way, they were reaping the benefits of one of nature's most powerful antibiotics. It's incredible to think that something so simple could have such a profound impact on human health. Number 1, ancient Egyptian medicine man. In 1826, an ancient Egyptian papyrus known as the Edwin Smith Papyrus was purchased by American pathologist Thomas Dent. It contained some of the earliest known medical writings from ancient Egypt, including a detailed account of a botched-up surgery. The surgery in question was a trepanation, or the process of drilling a hole into the skull, and it seems that the patient didn't make it. The papyrus describes how the surgeon opened up the man's head to relieve pressure on his brain, but the man ended up dying from an infection. What's really fascinating is that the papyrus also includes a case study of a similar surgery performed on a woman, along with detailed instructions for how to carry out the procedure. It's like an ancient medical textbook. Up until this point, it was believed that the ancient Egyptians didn't perform surgery unless it was absolutely necessary. But this discovery suggests that they were much more advanced than we thought. In fact, they may have been performing surgery on a regular basis. Thanks for watching. Which of these ancient Egyptian discoveries shocked you the most? Let me know in the comments below, and don't forget to subscribe if you haven't already. See you next time.